India's COVID-19 emergency reaches critical levels. Hospitals are out of beds and oxygen, and crematoriums don't have space for the dead. What's the fallout for the rest of the world if the crisis isn't contained? This is Inside Story. Hello and welcome to the program. I'm Mohammed Jamjoom. Patients gasping for air in the street, pleas for oxygen and hospital beds on social media, and funeral pyres burning around the clock. This is the reality of India's COVID-19 second wave, the worst in the world. This chart from Johns Hopkins University shows the number of infections going up more and more rapidly. India recorded more than 360,000 cases and 3,300 deaths on Tuesday. Experts are blaming political gatherings and religious festivals for the surge. The government has ordered Twitter, Facebook, and Instagram to remove posts criticizing its handling of the crisis. Overwhelmed hospitals are turning away the critically ill.
I'm a health worker, but if someone dies in my family, I won't even be able to say final goodbyes. Even those in big leagues, the rich and powerful people, are not getting to see their loved ones for the last time. The hospitals are only showing bodies completely packed in PPE kits. What can they do?
It has taken 2.5 hours for me to commute from my place and come here for this oxygen, so I cannot take back her without an oxygen. So I have to give it to her no matter how much time it takes. I have to wait here.
We are searching oxygen all over India, all over Delhi, to Chandigarh, Ludhiana, Haridwar, Jaipur, and all our nearby cities from 200-400 kilometers far. We are catching oxygen to give this. All our vehicles are on the roads who are searching the oxygen.
Elizabeth Puranam reports from one of the crematoriums set up in New Delhi.
We're at a makeshift crematorium that's being set up here in New Delhi because the actual crematorium behind it can't cremate all of the bodies which are being brought there every day. It is a similar situation in every crematorium here in Delhi and many of the other badly affected states. The Sarai Kale Khan crematorium has been working from 6 o'clock in the morning until midnight. It still had to put up 50 funeral pyres in the park next to it, and it's now putting up another 50 in this open space here. The situation is such here in Delhi that after going from hospital to hospital to have their sick family members admitted, people have to go from crematorium to crematorium to have them cremated in a country where funerals should be taking place, do take place as soon as possible because of custom, because of the hot temperatures, because of a shortage of mortuaries with freezing facilities. And all of this is why the international aid that's arriving is so welcome. South Korea is the latest country to say that it's going to be sending oxygen, sending everything from medicines to diagnostic tests to protective gear. But South Korea is also arranging flights to bring its citizens back from India because it sees that its poorly funded public healthcare system cannot deal with the world's biggest surge in cases, and there are no hospital beds or oxygen in many hospitals and states still. Elizabeth Puranam for Inside Story.
The World Health Organization says the situation is beyond heartbreaking. The United States, the EU, Russia, and China are among countries sending oxygen and medical supplies. And India, the world's biggest vaccine maker, is now forced to import jabs. The White House's chief medical advisor, Anthony Fauci, told an Australian newspaper that wealthy nations have failed to prevent a tragedy. All right, let's bring in our guests. In New Delhi, Harjeet Singh Bhatti is a medical doctor and national president of the Progressive Medicos and Scientists Forum. In Southampton, Michael Head, senior research fellow in global health at the University of Southampton. And in Doha, Patrick Tang, division chief of microbiology at Sidra Medicine. A warm welcome to you all. Harjeet, let me start with you today. We are seeing these horrific reports out of India. Hospitals across the country are reporting a shortage of medical oxygen and a shortage of beds. Crematoriums are running out of space. Funerals are being held in parking lots. Bodies are being burned in car parks. How dire is the situation and how much worse could it get?
the situation is already very worse, and we are seeing. I have not seen this type of situation ever in my lifetime. That people who are struggling for oxygen. I have not seen that people who are standing on roads and showing their oxygen saturation. That, see, doctor, our oxygen saturation is so low. Please provide us oxygen bed in the hospital, or please provide us some help. But we were so helpless that all the healthcare infrastructure is overwhelmed. All the beds are fully occupied. Even inside the hospital, when I am inside my ward, I have to make life and death decisions within seconds, because so many patients are on oxygen. So we have to decide whom to put on ventilator, whom to keep on oxygen. So it is a very, very difficult situation. And as we are seeing that now, more and more patients are getting infected. So I am thinking that if not active intervention was done, then the coming days will be very, very difficult.
Michael, in the past 24 hours, there have been more than 360,000 new coronavirus cases in India. There have been over 3,300 deaths in India in the past 24 hours. And the positivity rate is somewhere between 18 to 20%, as I understand. That means that the country is not able to test enough people, and that the real number of cases and deaths could be much higher than reported, correct?
Yes, that's correct. I think we can rather sadly anticipate that the official numbers are probably massively undercounting the true situation on the ground. So we can expect the daily number of new cases to be multiple times higher than what we're seeing. And I think we can expect those death counts to go up on a daily basis for the foreseeable future. I think, as my colleague in India mentioned just then, it probably will get worse before it gets better. So it certainly is a very grim situation in India right now.
Patrick, I want to talk about the fact that while what's happening in India right now is certainly catastrophic for India, but the fact is India is also the world's largest vaccine maker. It's considered the pharmacy of the world, and many developing countries are counting on India to provide them with COVID-19 vaccines. So what's happening in India, beyond just being catastrophic for India, is also catastrophic for the rest of the world, isn't it?
Yes, that's absolutely true. This, first of all, is an absolute tragedy for India. It's the kind of situation that all of us wanted to avoid with all of the measures that we're trying to do with public health and with vaccinations. So I think the devastation that we're seeing in India is going to affect the vaccine supply for the world. Almost half the world is getting vaccines from India, especially a lot of the lower income and middle income countries, including some of the Western countries as well too. So I think at this stage in the pandemic, it's absolutely crucial that we vaccinate our population and we vaccinate them as fast as we can, so that these variants can't spread in different parts of the world. So having any reduction in the vaccine supply around the world is going to have very bad effects for the rest of the world.
Harjeet, how concerned are you about the effects of the new COVID variant that was first identified in India?
Yes, this new variant is actually causing a severe infection, and the second thing is that it causing severe infection in the young adults also, like those who are not having any comorbid illnesses or otherwise healthy individuals, but they are getting severe infection. Previously, usually it is infecting only to the elderly people or to the immunocompromised individuals. The severity is more in this group, but this time this is causing more severe infection in the adults also. So it is definitely a mutated virus and having a much more severity.
Michael, how much do we know at this stage about how many cases might be attributed to the variant that was identified in India? I mean, do we know if it's driving infection rates right now? Because as I understand, there's still quite a bit to learn about it, right?
Yeah, there is very limited sequencing capacity in India. So we don't know too much about this new variant of interest, or we don't have a proper count in terms of the prevalence of the different variants across these COVID-19 cases that we're seeing each day from India. So there is a lot to learn about it. I think it's fair to say that we would be seeing a massive increase in cases per day anyway. If you have susceptible populations mixing, then this is what happens. All of the variants of COVID-19 are pretty good at transmitting. I think the only question really is, again, as our colleague said, as to whether it's more severe than other variants and is causing more severe illness, and whether it is more transmissible than other variants. But either way, India is in a pretty bad place right now.
Patrick, all of this is really putting into stark relief what a gaping and growing divide there is between developed and developing countries and their access to medicines and vaccines, is it not?
Yes. Anything that stops our efforts to control the spread of the virus, anything that impedes our ability to distribute vaccines and medications to the world, is going to hamper our response to the pandemic. So this is very devastating, not just for India, but for the rest of the world.
Harjeet, countries like the US, the UK, and Germany have all pledged to send aid to India. As I understand it, aid has started to arrive, but many health experts say that this is really just a drop in the bucket. What is happening thus far with the aid? And from your perspective, do you think it's going to be enough to make an impact and start turning things around?
All those countries who are supporting India in this situation is obviously very good, and even our government also welcomed all the steps done by other countries to support India. But the thing is that the main active support or the active intervention can only be done by Indian government. And if more and more healthcare infrastructure is developed in a short period of time, if oxygen supplies are adequately provided, so that all the industrial use of oxygen can be halted for some time and all will be used for medical oxygen, and isolation centers is developed, and more vaccination centers can be developed in a short period of time. So all these things are like, they need a very strong commitment from the policymakers. And if this can be done at government level, then any support from other countries will be helpful. And this, I want to say that any support by anyone will be life-saving in India.
Michael, countries like India and South Africa made a proposal some months ago to the WTO asking that intellectual property rights of pharmaceutical companies be waived, and that would allow developing countries to produce COVID-19 vaccines. Of course, the U.S. and other countries blocked negotiations at the WTO of that proposal. It seems that perhaps that stance might be softening right now as a result of what's going on in India. Are you seeing indications that that stance might change? Because there is supposed to be a meeting about this issue later this month at the WTO.
Yeah, for sure there will be more discussions on that. It has been a little bit disheartening, I think. We should be sharing knowledge as much as we possibly can during this pandemic. But it's not just about the sharing of intellectual property rights. Manufacturing vaccines is a tricky process, so scaling up new sites quickly is very hard. Can be done. We certainly can and should increase capacity across the world to do that right now, and intellectual property rights is part of that. But I think certainly if we can do that right now, then good. But also that's an important question for in between pandemics, before the next pandemic, is to work out where we can scale up manufacturing, build new sites, have them ready for the next public health emergency, whenever that be.
Patrick, you heard Michael there talk about the fact that, countries need to be scaling up and preparing before the next public health crisis. But are countries learning the lesson from this right now? I mean, are countries being more transparent about the challenges they face with health care? Do you think that this is going to change so that by the time there is another huge public health emergency or pandemic, the world will respond in a much more rapid fashion and be able to help other countries more quickly?
That's a very good question, and it's a tough one to answer. I think we all hope that the lessons from this pandemic is that all countries are going to be better prepared next time, and that we strengthen our public health systems, and we have a system in place to produce vaccines and do research for medications, and that's what we all hope will come out of this pandemic. But that remains to be seen, right? So I think it's important that as this pandemic winds down, over the next year or so that we maintain this pressure on the governments, that everyone in healthcare and public health maintain pressure so that we don't forget all of these things that we've learned and all of the suffering that we've gone through during this pandemic.
Harjeet, you spoke a little while ago about just how imaginable all this was, what's going on in India. I want to ask you a bit of a more personal question. How difficult is it for you and other members of the medical profession in India that hospitals are having to turn away patients and the fact that people are dying who could otherwise be saved?
Yeah, very difficult. And we are like, when it is very difficult to counsel them to go for another hospital or search somewhere else. And even not only that they are searching for hospital beds or they are searching for oxygen, and they are managing their patients at home. And when even I am supervising or treating many of the patients who are at home, I attend calls for them and manage them at home and tell them what to do and not to do. So all these things we are doing as a healthcare worker, and it is very exhaustive and traumatic also to maintain all these things at this moment of time, because whether we are on duty or we are off duty, we are continuously working for the patients. We are continuously either attending calls or in wards, we are attending patients. So it is very exhaustive, and it will become very difficult when we have to turn some patients and tell them that please find out another place to get your patient admitted.
Michael, if there is uncontrolled spread of the virus in parts of the world, doesn't that mean that at some point there's a greater chance that new mutations and that new variants will develop that might escape the protection of the vaccines that have already been developed?
So yes, certainly the more COVID-19 you have, obviously the greater burden of disease, but also you are more likely to have new variants of interest and variants of concern emerging. And that might have an impact upon vaccine effectiveness. I think it is very likely that we will, in the relatively near future, in the next year or two, need to develop booster doses to counter new variants. That is fairly likely, I think. So the battle against COVID-19 is going to be a long one, even here in the UK, where our current vaccine rollout is fairly advanced and cases are relatively low. We do still need to be cautious about COVID-19 and plan and prepare ahead of any possible new outbreaks. So, yeah, it's a long battle ahead yet.
Patrick, what do you say? Are boosters going to be needed, and are they already being developed?
Well, boosters are being developed, and there's a lot of talk about new versions of the vaccines. But I think, you know, the evidence is not out that that's absolutely required. And if you've looked at, you know, where we've had a lot of different variants develop, and we look at the most successful strains that have spread around the world, they have shown some degree of convergent evolution where they share many of the common most successful mutations. So we're seeing that in many different places where these variants arise, and they share the most successful mutations. So it looks like the virus is running out of successful mutations to develop. And what the other thing that's very reassuring is that in countries that are starting to look at the efficacies of the vaccines in the real world, not in the lab, looking at whether the antibodies bind or not, is that they're seeing that there is protection from the vaccines against these new variants, against severe disease, against death. They might not protect against mild infections 100%, but that's going to be okay if enough people get vaccinated. So I think I'm reassured that you know, the virus is running out of mutations and that the vaccines are very good, and we shouldn't be casting doubt on the efficacies of the vaccines. If we get enough people vaccinated, we can eventually reach that post-pandemic phase.
Harjeet, it was just last month that India's health minister said that the country was in the end game of the COVID-19 pandemic. I mean, there was a sense that in India, the government believed that it had really gotten past the worst part of the pandemic. Now, it's a situation where everything is in short supply, and there's just a staggering amount of new cases every day. Why wasn't the government stockpiling supplies? Why weren't they doing more to prepare for this eventuality?
Because the first thing they thought that because they have developed a vaccine and now vaccine was promoted as a treatment rather than being a preventive measures. And second thing, that the patient load was also decreased at some time, like in December and January. Patient load was also decreased, so they thought that we win over a virus, and now we can continue with their daily lives. And even the people have laxed their adherence to the COVID appropriate behavior, or they stopped wearing masks. They have started mass gatherings. So everything was gone so wrong that within few months we again came to this situation. So that's why I just want to also add one thing, that even I am now seeing people who had COVID infection last year also have 2 doses of vaccine, but still got infected by this virus. So the thing is, we have to keep in mind that this virus is mutating very fast. It is learning new and new ways to invade into human system and causing infection. So we all should follow COVID appropriate behavior as much as possible and avoid mass gatherings. This must be a learning lesson to all of the world.
Michael, the Serum Institute of India is a major contributor to the COVAX initiative, which is providing vaccines to low and middle income countries. It has said it will not be able to meet its international commitments to deliver vaccines due to domestic shortages. What's the knock-on effect of this?
So I think that shows that it is tricky to rely on just one manufacturer to supply vaccines essentially for the world right now. So India will retain much of the vaccine supply coming out of the Serum Institute, and who can blame them? But that obviously will have a knock-on effect for COVAX, other low and middle income settings, and also high-income countries like the UK, who get their vaccines from AstraZeneca from the Serum Institute as well. So that will mean that their COVAX rollout is slower, so there will be a greater burden of disease and more unprotected people in those populations. So again, there will be consequences in terms of a lack of supplies from the few manufacturing sites we have around the world, of which a key one is in India.
Patrick, if the COVAX rollout is now slower because of what's going on in India, what does that mean for the overall situation? And from your perspective, are there other countries that are going to be able to pick up the slack?
This is a difficult one because India, a lot of countries do depend on India for their vaccines. So when there's a slowdown in the distribution of vaccines around the world, it's going to allow more cases of the disease to develop. And this is, and as I said before, this is the end game. This is where we need to vaccinate as many people as possible, as fast as possible, so that we can reduce the number of people that die from it and reduce the number of people that get severe disease from COVID. So it's absolutely crucial. And I don't know, it's very complicated to set up vaccine manufacturing because it requires a global supply chain. It requires a lot of quality assurance. So it's not easy to be able to pick up the slack from the manufacturing in India.
Harjeet, from your point of view, the fact that the Serum Institute is not able to meet its commitments when it comes to the COVAX initiative, the fact that so many developing countries are counting on these vaccines from India, how concerned are you about what the situation is in India and how that will affect the rest of the world?
I'm very much concerned as a healthcare worker because I want everyone should be vaccinated as early as possible, because even if you get infected after vaccination, the infection is very mild and it has a protection. So everyone should vaccinate it, and I am much more concerned about, first and foremost, for the Indian people, that everyone in India should get vaccinated as early as possible. And after that, the whole world, I know that everyone is dependent, as you already said, that it is a pharmacy of the world. So everyone should get vaccinated, because every life, I have seen people dying on roads, and it is very difficult to see them die because of this infection. So they all must get vaccinated. This is must, yes.
All right, we have run out of time, so we're going to have to leave the conversation there. Thank you so much to all of our guests, Harjeet Singh Bhatti, Michael Head, and Patrick Tang. And thank you, too, for watching. You can see this and all of our previous programs again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. For me, Mohammed Jamjoom, and the whole team here, bye for now.